Hello everyone, this is Dr. Kishore Alapati. I'm a consultant colorectal surgeon working from Apollo Hospitals Jubilee Hills in Hyderabad. Today we will briefly discuss about Crohn's disease, which is one of the main sections of inflammatory bowel disease. So inflammatory bowel disease is divided into two parts. One is ulcerative colitis, one is Crohn's disease. Today we will talk about Crohn's disease. Crohn's disease is a disease which affects from mouth to anus, which means the entire intestinal tract is affected by Crohn's disease. This is characterized by what we call typically granulomas, which causes ulcers in the small intestine or large intestine or in the anus. It causes linear fissures, which means cracks in the inner lining of the intestines, and this eventually causes bleeding from these intestinal areas. So most of these patients who are suffering with Crohn's disease typically tend to have either mucus or like a slimy material that come in with the bowel movements, or blood associated with bowel movements. And usually with these symptoms, a good number of times it causes crampy abdominal pain along with loss of weight and or loss of appetite. The diagnosis of Crohn's disease typically happens when we do a scopy, which means when we do an endoscopy or pass in a camera through the anus into the entire large intestine, and we also go into the last part of the small intestine to take a look in there, biopsy that area, and when we look at these tissues underneath the microscope and when they show these classical signs, then we stamp it as Crohn's disease. Fair number of times, meaning up to about 90% of the times, Crohn's disease can be controlled with medications. There are a variety of medications that are available these days in the market that we are able to control the Crohn's disease with. Medications, the disease is not being controlled, that is when surgery becomes option for Crohn's disease. So when surgery is typically considered is when there is a significant amount of narrowing of the intestine, or when the intestine has ruptured open because of the severity of the infection, or when the intestine has caused a local pus pocket or what we call an abscess in that specific area. Or in Crohn's disease, most commonly another problem that we see is an anal fistula, which means an abscess by the buttock area, which with multiple abscesses in the anal region. And then when we do a scopy in these patients, then we find these classic symptoms, and that is when we diagnose an anal fistula secondary Crohn's disease. So these are the various time frames when patients would require surgical intervention for Crohn's disease. So if you have any abdominal pain chronically, mucus or slimy material in your bowel movements, and or blood in your bowel movements on a regular basis, please do come and see your gastroenterologist, ask for a colonoscopy, get diagnosed and get the treatment done, because it can save your lives. Thank you.